This is a 30-bed community hospital in a rural area. It runs efficiently and is a lifeline to the local community. But things were not this way when I first arrived. It was July, and I had been appointed the new hospital director. And let me tell you, it was one of the most mismanaged I've ever seen. There was Dr. Cha, who believed that the only way to better health was to spend a lot of money.
เครื่อง CT สแกนเลยนะหมอจอยเราจะได้วินิจฉัยและรักษาคนไข้ได้เร็วขึ้น
Miss Nana was a familiar face at the hospital, a pharmaceutical rep who sold expensive medicine. She was pushing drugs that cured a new type of allergy found in children.
ยานี้เป็นยานำเข้าจากต่างประเทศเลยนะคะที่ต่างประเทศนิยมกันมากๆเลยค่ะรบกวนคุณหมอรับไว้พิจารณาด้วยนะคะค่ะ
Even getting to just one patient visit took hours, but it was such a small town. I met Don, the community leader, who looked after his sick father.
ผมเองก็ดีใจนะครับที่คุณหมอมาเยี่ยมปูดำในวันนี้ใจจริงผมเนี่ยอยากให้คุณหมอเนี่ยมาเยี่ยมบ่อยๆเลยนะครับปูดำแก่ๆมากแล้วครับจะเดินจะเหินเนี่ยลำบากเหลือเกินยิ่งวันไหนจะต้องไปโรงพยาบาลด้วยแล้วก็โอ้โหเรื่องใหญ่เลยครับ
I met Professor May and her team of researchers at a local market.
ช่วงนี้เลยอะค่ะโรคไข้เลือดออกกำลังระบาดหนักเลยอะค่ะในชุมชนของเราเมื่ออาทิตย์ก่อนมีเด็กเสียชีวิตไปแล้วค่ะ2 รายเลยค่ะ
The evidence I collected on the ground and what the hospital was setting as their priorities didn't match up. I knew I needed to turn things around immediately.
นี่คืองบประมาณของปีที่แล้วค่ะ
ขอบคุณค่ะ
I studied the records and stats, but the answers were also in the local community. I wanted to hear everyone's thoughts before making decisions. It was a rural community, so patient visits were crucial. But the medical van was too big for the small roads. It was more practical to get some medical motorcycles. A CT scanner was out of the question. We were a small hospital, and a big one nearby already had the machine. We could send patients there if needed. We didn't buy the expensive imported medicine. This type of allergy was not yet found in our community. And if it was, we could treat with a local-made medicine that was more budget-friendly. We're a tropical country, prone to dengue fever outbreaks. More patients were getting admitted with infections. So we decided to spend our limited budget on controlling the outbreak immediately. And that's how this hospital was transformed. By using evidence-based priority settings and involving people, we've made huge improvements to some of the most inefficient systems. Imagine how many more lives will be saved if everyone did the same.
Evidence-based priority setting is fantastically important because it means that you can achieve the best value in healthcare for your population.
It means fair process for using public resources.
If you don't use priority setting, you have to make the decisions some other way, so you're going to maybe just make them on political reasons rather than evidence-based reasons. You're going to listen to the people who demand most rather than the people who need the most.
It means that we make the wisest use of limited resources based on equity and cost effectiveness.